Hello, and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for February 15th, 2023. My name is Kirsten Ambrose, and I want to thank you for joining us this month. Today's talk will be co-presented by Molly Minnig and Yvonne Golightly. Molly Minnig is a third-year PhD student in the Department of Epidemiology at the Gillings School of Global Public Health at UNC Chapel Hill. Molly completed her undergraduate degree at the University of Pennsylvania and her Master's of Science in Global Health at Duke University. Molly's research interests are in injury epidemiology, with topics ranging from community-level injury prevention strategies and sports medicine to topics in the musculoskeletal imaging field. Yvonne Golightly is an epidemiologist and a physical therapist who is a professor of physical therapy and the assistant dean for research at the University of Nebraska Medical Center College of Allied Health Professions. She also is a faculty member of the University of North Carolina's Thurston Arthritis Research Center and is co-director of research for the Osteoarthritis Action Alliance. Her research focuses on osteoarthritis, musculoskeletal injury, and physical activity. The title of today's presentation is Investigating the Barriers and Facilitators to the Adoption and Implementation of Injury Prevention Exercise Programs. I'd like to welcome both of our speakers and turn it over to Molly to lead us off.
Awesome. Thank you so much, Kirsten, for the introduction. And thank you everyone for joining us today. This presentation is focused on one of our recently published narrative reviews. And if you're interested in taking a look at the full paper, feel free to scan the QR code on the slide and you'll get directed to an online PDF of it. Before we get started, Yvonne and I just want to acknowledge and thank the hard work and expertise that our co-authors brought to this project, without whom this work wouldn't be possible. So thank you to everyone on the slide. Just to give a brief overview of what we plan to cover during this talk, Yvonne will start us off by giving some background information on musculoskeletal injury and injury prevention exercise programs. We'll discuss our methods of literature search for this narrative review paper, describe the literature we found, and then the bulk of our talk will be spent going over some of the recommendations for future research on this topic and specifics on how to improve injury prevention program implementation rates. And so with that, I'll pass things over to Yvonne to get us started.
Thank you, Molly. To give us some background on this topic, it is very common to have musculoskeletal injury, and this includes injuries to ligaments, tendons, muscles, bones, and joints. And it's been estimated that at least 1 out of every 15 healthcare visits in the US is for musculoskeletal injury. And of those injuries, 1 out of 4 are sprains or strains, which often occur during sport. And I want to draw your attention to the figure that's here on the right that shows musculoskeletal injuries seen in emergency department visits, which was nearly 19 million visits in 2013. And what I've highlighted here in the blue box is sports as a cause of musculoskeletal injury, and it's presented by sex and by age. And what's notable here is when you're looking by age, the largest proportion of the injuries are in the youngest group, so those less than 18 and 18 to 44. And this isn't surprising considering that these groups are more likely to engage in sports. But the consequences of these musculoskeletal injuries at younger ages are significant, which I'll talk about in the next few slides. And one final thing that I want to point out is that these numbers on this slide likely underestimate the problem of how many people are having these injuries. Next slide. This is an injury pyramid, which is used to illustrate how underestimates occur. And so the pyramid shows the different levels of care after an injury. Estimates from hospital data are the most valid and reliable, but we know that most musculoskeletal injuries are addressed in the emergency department, outpatient clinics, or are treated at home or on the sports field. And those often aren't reported or well reported in injury surveillance. So we don't know the true magnitude of the musculoskeletal injury problem, but we can assume that it's large. And next slide. As many of you know, osteoarthritis, called OA for short, is a major public health problem, and there are several factors that contribute to the occurrence of OA. These include age, sex, obesity, and other factors. And as highlighted here in blue, joint injury is a major risk factor, and we see a link between OA and elite sports. Next slide. So what underlies this connection between injury and OA? The initial injury can cause changes in joint tissues and affect the health of the joint, and these alterations can lead to OA in the future. And so I have some fast facts here to emphasize the impact of knee injury on athletes and the immediate and future impacts on their lives. So anterior cruciate ligament or ACL injury is a serious injury to the knee, and it occurs in 1 out of 36 athletes. And there are a number of potential consequences from ACL injuries. Of those who have this type of injury, 1 out of 3 do not return to sport participation, and 1 out of 2 do not return to their prior level of sport. So these injuries can really affect people's lives. It can take them away from a sport that they enjoy doing. It can change their ability to engage in physical activity. And for adolescents, it can also impact their social lives if their social circles center around the sport. And further down the line, having knee injury makes the long-term consequence of knee OA more likely by 3 to 6 times. And there is evidence that 1 out of 2 individuals with an ACL injury rapidly progress to knee OA within 10 years. So this means that someone with an ACL injury in their teenage years could have OA by the time they are 30. Next slide. So what can we do? We need to prevent these injuries, and in thinking about injury prevention and its relationship with OA, we need strategies that also address OA prevention. For me, it's helpful to think about injury and OA relationship over the life course, and injuries can occur at any stage of life, but we're especially interested in those injuries that happen before the occurrence of OA. At the bottom of the slide, there are some different types of prevention. We often think about primary prevention, which is preventing a disease or an injury from ever occurring. But there's also secondary prevention. So for example, this is if an injury does happen, how can we make it less severe? And then there's tertiary prevention, which is if the injury happens, how do we minimize its long-term effects? Next slide. So injury prevention exercise training programs are a solution to the injury and OA problem. And what is important is they address all 3 types of prevention. There are a number of these programs that have been developed for athletes, and they have similarities in that they include components like neuromuscular training, plyometric exercises, balance training, and stretching. They're often performed 2 to 3 times a week, and they can be a part of a pre-existing warm-up or conditioning routine done by the athlete. And these programs help prevent initial injury, but they also may be useful for preventing re-injuries and injury to the other knee, and they can improve sport performance. Yet we find that few teams implement these programs, and sustainability can be an issue too. And this was puzzling, so our group asked why. Dr. Jeff Spang, who's an orthopedic surgeon at UNC, who does a lot of these ACL surgeries, he was the one in our group who asked this question first, and we agreed it was a good question. So Molly led our group in answering this. Next slide. We had 2 objectives with our work. The first one was we wanted to describe common barriers and facilitators to the use of these programs. And second, we wanted to identify steps that needed to be taken to promote the uptake and continued use of these programs. And now I'll pass this back to Molly so she can describe the work that she led.
Awesome. Okay, so 2 authors conducted the search within 5 online databases. We used a combination of the following search terms to identify literature: implementation, exercise program, injury prevention, and sports. We chose to conduct a comprehensive narrative review on this topic rather than a traditional systematic review, because our goal was to capture a broader, larger scale view of the current literature, investigating the implementation barriers and facilitators within a really wide range of youth and adult non-elite athletic communities. Data extraction, which is an aspect common to systematic reviews, wasn't feasible for all eligible articles we found due to the wide variability in article type, study design, and specific research area. Titles and abstracts were reviewed first, and then full articles were retrieved for those that included the information on implementation of injury prevention training programs. We performed quality assessments on the identified articles, and we used two different assessment frameworks, one for qualitative studies and another for systematic reviews. The quality assessment frameworks allowed us to evaluate the article's data collection strategies, sampling methods, potential biases, and their overall scientific quality. Through this searching, we found 23 publications that fit our study criteria. The majority of these articles looked into barriers regarding the implementation of specific programs, and then 7 kind of more generally discussed how to approach implementation science on this topic. We paid attention to the geographic locations of these studies as well. We found that 3 were set in Australia, a few were set in the US, Scandinavia, Canada, and Switzerland. And then there are also a few systematic reviews that span multiple locations. We collected data on the most commonly reported implementation barriers in the literature we found. We noticed that the perceived cost and time burden of injury prevention exercise programs were commonly noted as barriers to their use. And unsurprisingly, we found that many of the reported barriers had to do with coaches' attitudes and beliefs towards injury prevention more generally. Some barriers indicated that coaches lack the confidence in their ability or knowledge to implement a program, while others indicated that coaches simply don't prioritize injury prevention methods. Conversely, many of the facilitators to implementation we found had to do with stakeholders feeling knowledgeable about the need for injury prevention strategies and the knowledge that these programs really are efficacious. Some of the key facilitators included that the program was able to easily be integrated into the team's pre-existing practice routine. And additionally, literature found that motivation from both coaches and athletes, and not just focusing on the coaches, was an important facilitator to implementation. Based on these results, we structured a number of recommendations for ways to improve our knowledge around injury prevention exercise program implementation and overall implementation rates towards researchers and administrators. So I'll start with some suggestions we have directed towards researchers in this field. We found that many of the articles uncovered through this search strategy were set within randomized clinical trials. And while randomized designs are certainly necessary for testing the efficacy of new injury prevention training programs, we really suggest that future studies focusing on the implementation of these programs take place in real world settings outside of the ideal testing environments created by randomized trials. And pragmatic or hybrid study designs would be useful to accomplish this goal. Evidence is lacking on the best strategies to disseminate these programs and ensure their widespread uptake, adoption, and particularly their sustained use over time. And we suggest that the use of a few different implementation-specific frameworks that can guide future research on this topic. So first, we echo literature published by injury prevention researcher Caroline Finch and support the use of the Translating Research into Injury Prevention Practice, or the TRIPP framework, as well as Darren Padua's 7 steps for developing and implementing a preventive training program as roadmaps to really guide the implementation planning process. To direct how we evaluate program and implementation success, we suggest that the reach, effectiveness, adoption, implementation, and maintenance, or the RE-AIM, and the TRIPP frameworks be used. And additionally, it's important to note that long-term studies on this topic are needed to better understand the use of injury prevention training programs, how the use of these programs endures over time. The general principles of these 3 frameworks presented on the previous slide are pretty similar. The overarching goals are to guide implementation strategies that lead to sustained use of programs over time. And to give everyone a better idea of the specifics of how to go about reaching this goal, I'm going to briefly discuss in more detail Caroline Finch's TRIPP framework. So this framework is a 6-step guideline and is best based on the idea that sports injury prevention needs its own framework due to the unique challenges that differ from those in other related injury fields, such as road traffic injury and firearms, et cetera. So step 1 involves injury surveillance methods and is an important first step that informs all future stages of the framework. Robust surveillance methods are needed to get a full picture of the burden of injury in a wide variety of sports and geographic settings. Step 2 includes understanding the mechanisms of injury so that approaches for prevention strategies can be targeted and specific. Step 3 involves actually creating a preventative approach. This step should be accomplished using data on key risk factors that were found in the previous step. And Finch notes that this step should also involve a multidisciplinary team of public health experts, biomechanics, epidemiologists, and clinicians to kind of cover all related sectors of knowledge and increase the chance of creating a successful prevention program. Step 4 involves testing the efficacy of the new prevention program in a trial setting. And the final 2 steps are really imperative for future studies investigating the implementation of these programs. In step 5, it's important to understand whether current injury prevention strategies are working or not, and if they aren't working, why, and then to understand the key stakeholders' motivations and barriers to intervention uptake. In this stage of the framework, it's really about trying to translate the knowledge gained in the previous steps into something that will actually be used by those who need it. The final step of the TRIPP framework involves actually implementing the program into a real-world setting and evaluating its effectiveness. And ideally, step 6 will lead back into step 1 and an iterative process is formed. Drawing from some of the ideals we just talked about, we want to encourage the use of qualitative research, engaging key stakeholder groups in future research. And we see this strategy as a really valuable tool to better understand stakeholder motivations, knowledge, attitudes, and beliefs surrounding the implementation of injury prevention programs. Improving our knowledge base on this particular aspect of the implementation loop will be key to identifying successful initiatives aimed at improving implementation rates in the future. I just wanted to pull out a specific example of how effective qualitative research can be on this topic. And so through this review, we found an article by Muller et al. Published in 2021, which was a mixed method study set within the Danish youth handball community. In the qualitative portion of this study, the authors conducted semi-structured interviews with coaches and athletes to better understand their attitudes and beliefs towards injury prevention exercise program use. These interviews were based around the components of the RE-AIM framework, which I briefly mentioned earlier. Coaches reported that they were primarily concerned about the economics of recruiting and keeping athletes involved in their handball club. So the main priority at practice in their mind was to ensure that their athletes were having fun, especially in youth sports. That's really the reason kids are there in the first place. And if they're not having fun, they'll just switch to another athletic club. And so coaches offering boring practices would lose them money. Coaches therefore hope to find injury prevention programs that could be incorporated in a more fun, lighthearted way. And so this is just an example of results that show insight that we probably wouldn't have thought about when initially just designing an injury prevention program, but shows how important qualitative research on this topic can be and how it can bring really rich and interesting data. As noted earlier, the literature on this topic has thus far been set in high resource communities within high-income countries. We found a really striking gap in the literature investigating the use of injury prevention programs in culturally and economically diverse settings globally. As an initial step, we might suggest to start injury prevention implementation efforts in middle and high school settings within these communities. And it'll be important to draw from some key principles within the implementation and dissemination science realm to evaluate the social, cultural, and environmental context of communities where prior injury prevention efforts haven't tapped into so that we can maximize implementation in these areas. So literature right now is in agreement about some of the key factors that make injury prevention programs effective and implementable. We know that the programs need to be flexible and easily adaptable into a group's pre-existing practice schedule and routine. We also know that buy-in from key stakeholders is a really necessary first step to program uptake. Studies show that education efforts targeted at coaches help relay the importance of injury prevention efforts and can help them feel more adequately trained to implement the program themselves. Buy-in from coaches oftentimes isn't enough, however, and so it's important to increase motivations from athletes and parents. Players need to be involved in injury prevention programs, and as I noted earlier, it will be important to customize the messaging around these programs to the specific athletic community we're talking about, So maybe for youth athletes, it'll be important to frame the exercise as a fun, playful game. Whereas for older adolescent athletes, it will be important to emphasize the beneficial effects that injury prevention exercises can have on their biomechanics and athletic performance. Data shows that these programs can improve lower extremity strength, vertical jump height, balance, and many other aspects of athletic performance. Parents seem to be a relatively untapped source of buy-in and influence in this world, and literature on how exactly to tap into this group is lacking currently. Parents hold a lot of power within the adolescent sport world in terms of their time commitment and monetary commitment to their children's sports teams. Involving parents in injury prevention efforts could lead to long-lasting and wide-reaching change in the culture around sports injury. So we suggest that educational efforts on the importance of injury prevention strategies be targeted towards parents as well as coaches. And really just to note, this kind of stakeholder triad that I have on the slide doesn't represent all relevant stakeholders. It will also be important to understand the motivations of school administrators, NCAA athletic directors, professional sports organizations, just to name a few. As noted previously, we want to encourage the use of injury prevention exercise programs within school settings, as well as within recreational, non-elite athletic communities. There have been a few studies looking at the use of these programs in school physical education classes, which have indicated that programs can successfully reduce injury occurrence in these settings. However, further research is needed to understand the barriers and facilitators to their implementation within schools, as they likely differ from those associated with outside of school athletics. We see the expanded use of technology in this field as an important next step to increase the visibility of injury prevention exercise programs and widespread access to them. It's estimated that roughly 4 billion people worldwide own smartphones. So translating or developing future programs into the mobile app form seems like a no-brainer way to reach the widest audience possible. And as a not so shameless plug, we're actually working on a team right now to translate the Action Alliance's Remain in the Game exercise toolkit into a mobile app, which is currently in the beta testing phase. Essentially, the app allows users, or really anyone from coaches to athletes to athletic trainers, to build and customize an injury prevention program using a variety of balance, strength, plyometric, et cetera, exercises. And if you're interested, you can scan the QR code on the screen or click the link that Katie just sent in the chat. And that will take you to directions for how to download the Remain in the Game mobile app in its current testing phase. We welcome any feedback now before the launch is officially, before the app is officially launched in the App Store. So feel free to download and take a look at what an injury prevention program actually looks like. So to bring everything back together, we really have a good understanding from literature about what types of exercises are effective and should be included in an injury prevention program. We know that these programs work, they do their job in reducing the rates of injuries. We need to better understand why adoption and implementation rates of these programs remain pretty low, however. In particular, we need more research to be focused on understanding the implementation barriers and facilitators in a wider range of athletic communities, including geographic locations and resource levels, and then within comparing specific school and recreational settings as well. And here we kind of summarize some of our key recommendations to facilitate the implementation of future injury prevention exercise programs. These recommendations focus on improving the ease of use of the program, increasing stakeholder involvement and buy-in, and minimizing financial and time burdens. To reiterate, we think a lot of these programs can be accomplished through encouraging that future programs be made available in free smartphone mobile applications. We see the convenience and the ease of access to the mobile app as key factors that will encourage the initial uptake of these programs, but also their sustained long-term use over time. So with that, I want to thank everybody for joining us today, and we welcome any questions that anybody has.
Thank you, Molly and Yvonne. That's really interesting. I thought it was kind of eye-opening, when you start out framing the impact of injury and then opening it up to why injury prevention is so important and how simple really it can be to incorporate. People can add in anyone. If you have any questions, please put them in the chat and we will read them. One quick compliment, excellent information. Thank you for sharing. I do have a question. One thing that came to mind, you had mentioned throughout the talk several times the coaches and athletes as something of a primary audience. And then in the end, you indicated the triad of coaches, athletes, parents, and mentioned athletic directors, school administrators as people who have a vested interest or perhaps should about this kind of work. I think about other sports personnel. What about other people involved like athletic trainers? What role could they have in implementing these programs?
Yeah, great question. I really think it'll be a multi-pronged approach into getting all stakeholders involved in increasing the implementation of these programs. I will say from personal experience being an athlete in college, I do think athletic trainers have a lot on their plate already. My track athletic trainer was responsible for 4+ other teams at any given time. And so I do think it will require a multi-pronged approach and it shouldn't just be the burden of athletic trainers to implement these programs into practice.
That's great. And I was pleased that you mentioned athletic directors just as one example here at UNC, which of course I recognize is an elite athletic program on the scale that not all programs are quite as well resourced as a school like UNC. However, a couple of years ago when we were working on the Remain in the Game app, we worked with athletic trainers that were employed through the athletic department to do, just like you said with your track coach or track program, to work on several sports. So they were not tied to a specific sport and not, tied to a specific coach. However, they had good guidance from the work we had done at the OA Action Alliance, as well as from the National Athletic Trainers Association. So they were already pretty well informed themselves. So that was good to see. One question from the chat, any initial ideas on how to improve adherence to this prevention program? And then also, do there need to be seminars or outreach by athletic trainers, physical therapists, or other healthcare providers to increase adherence?
Yeah, I think that is a great idea. I do wonder about how monitoring of use of these programs will work over time. It may be that professional organizations should be encouraging and kind of monitoring how these programs are used. So like USA Track and Field or like the Coaching Association, something like that. I think that's a great idea about including seminars because I do think long-term education on this topic will keep it kind of front of mind and help everybody, coaches, athletic trainers, feel more prepared in implementing these programs.
Great, that is a good thought to have some seminars. So I'll give folks a chance to type in anything. But I'll just briefly note that because we're at our 30-minute hour, I will interrupt for 1 second just to note that we will be launching a poll at the end of this webinar. If you are still on, please contribute your thoughts to the poll. And then I'll just put a quick shout out for our next month, March 15th. We have a presentation by Christine Pellegrini, who will present on recruitment and retention strategies for underrepresented populations and adults with arthritis and behavioral interventions. So join us for that. One other question for those who can stay on for a few more minutes. It seems that many of these prevention programs are more for acute injury like ACL. But we know that chronic injury or pain, like, sorry, I'm not sure PFP stands for, can also progress to OA. What types of injuries were recorded within these prevention programs, and how much do you think that the information that you presented can be applied to more chronic injuries?
Yvonne, feel free to jump in. But I do think a lot of the injuries that were tested in the efficacy of injury prevention programs that we studied were for more acute injuries, so ACL injuries, ankle sprains, things of that nature.
Yeah, I think this is a really interesting question because it is hard to measure chronic injuries. And I agree with you, Molly, that a lot of these studies were focused on acute injuries. You know, my initial thoughts are that, you know, these prevention programs, because they're aiming to improve movement, you know, have healthier movement, have people be able to have the strength and power to adjust to certain motions like, you know, cutting and jumping, that it would, you know, when having healthier movement, we would see less injuries, whether they're acute or chronic. But that has not, to my knowledge, really been examined. So this is a really great question. Thank you.
Well, thank you both. I don't see any additional questions, but certainly if any come in, we will forward them to our speakers today. Thanks everyone for joining us. That will end our presentation for today, and I hope you have a great day and will join us next month.